Good afternoon, good morning, good evening, everyone. We'll give it just 1 minute longer as people are connecting their sound, and then we'll kick off. Waiting room 2. Should we start? Well, thank you everyone for joining this virtual dialogue today. I'm Kirsty Graham, the Director of Capacity Building at the Union for International Cancer Control, and it is a pleasure to be co-hosting this virtual dialogue today with Jhpiego, one of UICC's partners. Before we properly begin, I'd just like to bring your attention to a few housekeeping items. As always, UICC's virtual dialogues are hosted as meetings. And as such, it's possible for you to see all of the participants in this dialogue and for you to engage with each other and the speakers. So in light of this, it would be great if you could keep your cameras on, to unmute yourself only when talking, and to use the chat box, post any questions or comments there during the dialogue. We'll be capturing these questions and bringing these to the speakers during the Q&A as time allows. If we can, we may reach out to you to share your question directly. So to kick off, please introduce yourself via the chat, sharing your name, your organization, and location. So this dialogue is the second in a specific series in 2024 that we've delivered in partnership with Jhpiego, bringing attention to the 70-90 targets of the cervical cancer elimination strategy. 70% of women screened by 35 and 45 using high-performance tests, and 90% of precancers and invasive cancers being effectively treated. The dialogue is, however, one of many that we've co-hosted with Jhpiego over the last few years as part of our ongoing collaboration to support shared learning across the cancer community towards the achievement of the global targets for elimination. The first one that we held earlier this year was on implementing 70-90 and was focusing on the implementation and the lessons learned on cervical cancer screening and treatment, bringing insights from different projects across multiple countries. And it also served as a platform for the launch of new technical and programmatic resources. The recording for that conversation is available on UICC's website, and the tools are all available on Jhpiego's website, and the links are all there on the various web pages. So this virtual dialogue looks to build on that conversation and explore the question of how to reach scale, achieve the 70-90 targets nationally, and ensure sustainability, with financing being one of the critical enablers. It is my pleasure to now hand over to Deborah Bosmeyer, Senior Vice President, Global Programs and Technical Leadership from Jhpiego, to share a few further welcome words.
Thank you, Christy, and good morning, good afternoon, good evening, everybody. I'm very, very pleased to be here, welcoming all of you to this important discussion. As Christy mentioned, Jhpiego is honored to partner with UICC on the Cervical Cancer Elimination Dialogue series, demonstrating our continued organizational commitment to supporting countries to meet WHO targets. When Jhpiego started in cervical cancer almost 30 years ago, doing some of the pioneering work around VIA and the single visit screen and treat approach, we committed to driving our global technical assistance and service delivery approaches to prevent needless deaths from this disease. Still today, cervical cancer represents a top cancer killer for women. So together with many colleagues attending here today, we are supporting countries to introduce and plan for scaling up new elimination strategy approaches, including vaccination and HPV testing. Today's discussion is very timely, not only because we are picking up on the momentum of global moments, like the commitments made on the Global Cervical Cancer Elimination Forum in Cartagena, but because Now, many countries have introduced elimination strategy approaches like HPV testing and thermoablation. We now have learning from many countries on best practices to introduce and scale these approaches and how to organize service delivery to maximize coverage. So it's timely to talk about sustaining these gains. With these service delivery advances, we are seeing great progress in domestic prioritization of these approaches, from the creation of elimination strategic roadmaps and national cervical elimination plans in each country, as well as through domestic financing for these approaches that is equally important. We look forward to hearing about some of those best practices from countries' representatives today in our first panel. That said, we know that reaching the 70-90 target by 2030 is very hard and will take a collective effort that continue collaboration on the resources and global mechanism to finance these elimination approaches. So this is very critical to reach these targets. We are so pleased to be able to hear today from global partners who have been leading on resources and global financing for secondary prevention and get their perspective on how we can advance the research platforms available for elimination. So I'm really looking for a really wonderful conversation and discussion today. So thank you very much. Over to you, Christy.
Thank you, Deborah. And yeah, very apt welcome words, much appreciated. And it's great to see everyone joining this conversation. There's still more people coming in. And thank you to all of those who have started to introduce yourself on the chat. Please continue to do so. And we really hope that you enjoy this conversation today. We'll now kick off our first panel discussion, moderated by Blami Dao, Technical Director, West and Central Africa from Jhpiego. And this panel is really looking to showcase and explore examples of scale-up and sustainability in cervical cancer screening and treatment. Unfortunately, there was one member of this panel who last minute today had another urgent commitment, so was unable to join. But there are many other stories that we'll be able to share. Over to you, Blami.
Thank you, Kirsty. Good evening, good afternoon, good morning from where you are joining this call. As Christy said, we are going to share two countries' experience on scaling up and sustaining secondary prevention strategy. One of the countries is Philippines, and the other one is Guatemala. Unfortunately, our colleague from Botswana have not been able to join. This panel, as we said, will focus on what those countries have achieved and what have been the driver for their success. And then I will give some thought on what is happening in Francophone countries regarding the secondary prevention strategy. Let me start with Vincent Sumergido, who is the Supervising Health Program Officer, but most importantly, Deputy to the Cancer Control Division head in Philippines. Mr. Vincent, Philippines has made significant strides toward an elimination roadmap and anchoring the cervical cancer elimination strategy with a National Integrated Cancer Control Act and spearheading the operational planning and national costing and budgeting process for HPV procurement. So can you share with us your perspective and experience in prioritizing HPV testing and thermal ablation within the national agenda?
Okay.
Over to you,
thank
Mr.
you.
Vincent. Yes.
Okay, thank you very much, Professor Blami. Good morning and good evening to everyone. So I'm Vincent Sumergido. I'm working, and at the same time, I'm leading the screening, cancer prevention and screening program in the country right now in the Philippines. So basically, the country's strategy is really laying down the needed foundations for sustaining preventive interventions in the entire healthcare system. So I think one aspect that we are focusing right now is in terms of our interventions for health financing. So that includes the costing studies that the country is working on, of course, with the help of our different partners, so that the government will be well informed of the needed structures and technologies, such as the use of HPV DNA and at the same time thermal ablation machines. So this is very critical, especially now that there are other competing priorities aside from cancer. There are also other diseases that the country is really focusing on. So the costing will really provide that kind of information for us to direct and devote our limited resources for screening interventions. So noting that we have limited resources right now in the country, so one approach that we're also looking into is really packaging the different interventions, such as the integrated service delivery mechanism. So right now, the country is conducting the nationwide cervical cancer screening campaign, wherein all regions in the Philippines are being mobilized to do simultaneous cervical cancer screening. So we are using 3 different modalities. So we use HPV DNA. At the same time, we also use pap smear and VIA, and also for the different treatments such as the use of thermal ablation. So this is one of the first of its kind in the country to do such campaign to really improve and accelerate the cancer control program that we have right now. But I think the wisdom that why we're doing this is really to create that demand, so that the country will understand and the management that this is the need that the people on the ground really needs for cancer control. So in this campaign that we're doing, aside from providing HPV DNA and other cervical cancer screening modalities, we're also trying to integrate breast cancer screening and other women's services such as family planning, oral health, and vaccination, so that we can really maximize the available resources that we have. At the same time, I also wanted to emphasize that one aspect that we're also focusing right now is also aligning the intersectoral directions for cancer control, because we understand that fighting cancer isn't just the work of the health sector, but at the same time, we would need a streamlined intervention together with the education sector, the labor sector, and even social welfare, etc. So one defining characteristic that the country is really leveraging on right now is the Cancer Control Act, or the law that was enacted in 2019, that really helped put the needed governance and alignment among the different national agencies in the Philippines. So part of that work is really involving the creation of the National Strategic Plan to really streamline the different mandates of the different national government agencies and the private institutions to deliver the promises of the cancer law. And one of the main promise is really to include emphasis on the screening interventions as one of the main strategy in cancer control. And I think lastly, I guess we cannot also discount the importance of working with the private partners in the private sector to bring new technologies and technical assistance in the country to accelerate the screening and treatment interventions for us to have that high impact, high yield impact in among preventable cancers. So for example, we're partnering with Jhpiego, Expertise France, Unit Aid, and other stakeholders. And then this partnership is really instrumental in improving access to screening services, because right now we're really bringing screening services among far-flung areas because of the use of new technologies such as the HPV DNA and thermal ablation, which is, I think, the game-changing intervention in providing also treatment in areas with low access to healthcare. And of course, all of these successes doesn't really come without some cost. And right now, the Philippines is also encountering challenges such as the bottleneck in terms of the health technology assessment recommendation. So this is This is the mandate of the universal healthcare law in the country, wherein new technologies should really undergo health technology assessment to make sure that it's really cost effective. But while I think it's also a double-edged sword, that while we're ensuring that we're putting resource efficient interventions in the country, but I think it's also a bottleneck that we're seeing right now, because without the HTA recommendation, the national government cannot really procure new technologies such as the HPV DNA. So it doesn't stop the country, but we're also doing some work around on these challenges, this challenge by tapping the support of the different partners to continuously provide the supply of HPV DNA and thermal ablation while not using the government funds. So I think we've tapped also the global fund to cover this procurement so that we can continue the momentum that we have started as well. So while we're working on increasing the demand, we also learned that there are some systems intervention that we have also to improve at. For example, is the capacity building of the healthcare workers, because I think before the cancer law in 2019, the cancer control program has been one of the probably sleeping programs in the public health because it doesn't really receive a lot of funding. But right now that it has a specific line budget item, then the funding has increased, and then there's already that demand. But we learned that we have also we also need to really accelerate the capacity building for our different health workers. Because while we have these resources or available supplies of HPV DNA and other screening modalities, without the capacity of the health workers, I think we cannot go any more further. But we've tapped the support and we've partnered with the different doctors, the medical societies, specifically the Philippine Obstetrical Gynecologic Society, to augment us as screeners in the service delivery. So while we're doing this nationwide simultaneous mass cervical cancer screening, the different private sector doctors, the obstetricians and the gynecologists are really helping us provide the needed manpower for this one. Thank you.
Okay, thank you, Mr. Vincent. We have seen that Philippines has done a lot. If we just take the nationwide screening campaign, trying to address the secondary prevention approach through different angles, including capacity building, engaging the private sector, dedicated budget line for buying the commodity, for training providers. So there are a lot of challenges that you have mentioned, but what do you consider are the key success factors in this approach?
So I guess the key factors really are having that national policy, which is the law of the cancer control law. I think if I'm not mistaken, we are the second country in Asia to have the specific cancer law to provide that mandate for the different government agencies to deliver cancer control services intersectorally. So that's one. And I think the strong partnership, because we understand that the government cannot do it alone. So with the limitations that we have in the government right now, for example, the procurement, because of the limitation in health technology assessment, that is being also augmented and provided or being mitigated by the private sector, such as providing logistical support, and at the same time, the different human resource that we need to scale up the demand for screening services on the ground.
Okay, thank you, Vincent. I think what you have shared, yes, will inspire other countries who want to undertake a secondary prevention strategy around the 70 and 90 indicators. Now, let me turn to Dr. Claudia Camel from Guatemala. She's working with the National Program of Reproductive Health. Good afternoon, Dr. Camel. Guatemala has demonstrated commitment to elimination through national leadership and recently financing HPV testing through domestic procurement. I'm saying domestic procurement, which is really important. Can you discuss with us the key factor which had contributed to this procurement, and what were some of the challenges?
Good morning, everyone, and thank you for this kind invitation. I apologize for my limited English. And this moment, a law against cancer has been approved and accepted in my country. And I think that we expect more results in this in the future. I consider that the key factors that have contributed to the acquisition of HPV test detection in Guatemala are, at the first, is to recognize the responsibility to the state of Guatemala to guarantee the health of the population. The Ministry of Health has led this effort, but the support of civil society, health professionals, and even patients was very useful. And the second, scientific evidence has played a fundamental role in decisions making. Implementation projects such as PATH and Success have provided solid data that supporting the effectiveness and the DNA test in the detection HPV. These findings have confirmed the feasibility and acceptability to the self-sampling and have also driven significant improvements in the provision of services, especially to those with limited access to healthcare. And the first evidence-based training and education of the health professional promote decision-making and adaptation of the better clinical practices. I think that the acquisition of HPV detection test in Guatemala has been the result of collaboration of evidence highlighting the country's commitment and resolutions that the people can do and the dedication give us the results in acquisition of the HPV test. I think that there are challenges for implementation in each site. Screening with DNA test is highly programmatic. Therefore, challenges were considered was we ensure the capacity of the laboratory to process tests, and limitations in personnel and subsequently in physical space to continue the expansion, which was compensated with creating a schedule to processing and subsequently involving a new processing laboratory. Effectiveness in local purchasing process, it is a important theme to speak about this. Fear to the lower average usable life than permitted by the state purchasing and contracting law. Fear to not including important specifications in the purchasing process, since there are no biological chemists in each health department, and tendency to continue strengthening lower the detection methods such as cytology. I think that these are the important challenges for each implementation site. About the regional effort, like PAHO, Strategic Fund, I think that the purchasing through the strategic fund provides advantage in terms of economy of scale, prices, transparency in purchasing process, but can also present challenges in terms of flexibility, coordination, and risk associated with large-scale operation. I see the risk that are covered by the action of the technicians in charge of the programming process as a challenge and require time to consolidate large scale purchasing mechanisms. We continue to learn many details related to screening, such as that when we implement self-collection strategies, providers continue to direct the course of acceptability for our users, and therefore we advantage of the method. It will be essential to demonstrate that our system has been consolidated and the task inherent to the processing of the TNI tests have been identified, highly synchronized to guarantee this implied of the test, processing, monitoring of positive test, and guarantee of treatment. I think that we need flexibility in the libraries, possibility or replacement in case of no use the test, but I think that this consider or the requirement is or will be more accessible the test in our country, and of course the accessible prices for countries as our that can be always thinking in the prices excuse me, my English is limited, but I think that you can understand me. Thank you very much.
Okay, thank you, Dr. Carmel. And you have just mentioned to us that having a domestic procurement is not enough. There are still a lot of challenges around the procurement issue in a country like Guatemala. And we know that recently PAHO, the Pan-American Health Organization, which is the WHO Regional Office for Latin America, has put out a strategic fund for cervical cancer elimination. How do you see the contribution of that fund to the program that is being run in Guatemala and other Latin American countries?
Yeah, I think that in the purchasing of tests between the fund strategic can be realized for the reason of the pandemic, and because we don't have platforms to processing, and we need platforms with the HPV test too. And this first purchasing can it didn't do it.
Okay, so you are saying that basically the PAO Strategic Fund will offer a platform for the procurement among the countries in that region. Thank you very much for sharing those insights. Let me go back to Vincent. Moving forward, what will be your ask in terms of support from the cervical cancer community to achieve effective and sustainable scale-up? Because the main issue is really about scale-up. Fortunately, currently, Philippines is undertaking a nationwide screening program. But that can be done for a limited time, but it needs to continue forever, if I can say that. Over to you, Vincent.
Yeah, I agree with you, Professor Blamy. The intervention that the Philippines is working right now in terms of doing this nationwide campaign is just a start of the many initiatives that we will be working on for us to really create that demand and put that what you call this put that need in both government and private sector to really understand that we really need to move forward in terms of cervical cancer screening interventions. So in doing so, while we started it for this year, as we continue doing this initiative in the next few years to come, we would really be needing, of course, the help of the international community and the different authorities to provide the technical assistance and the logistical support, specifically such as the provision of donations for HPV-DNA and thermal ablation machines, because I think same with our colleague from Guatemala, we're also having challenges in terms of really having that local procurement for the entire country. So we're doing it on a pilot basis, but we are working in terms of scaling it up. And so that is our need, actually. So while we are working on the different necessary foundations in the health system, such as improving our financing, our partnership, and also the costing to really understand how much the country has to really invest in the next few years to come. The help of the different, of course, partners from the international community in terms of providing the technical assistance and the logistical support is really needed for us to continue that momentum that we're doing right now.
Okay, thank you, Vincent. And Dr. Carmen, what is your ask for the international community in order to maintain the coverage and the scale?
I think that we need better prices. Only better prices, and the other things we can work in the challenges that we present.
Okay. Thank you, both of you, for sharing really your country experience. As I mentioned at the beginning of the panel, I am based in Ouagadougou in West Africa, and there have been some initiative going on also in that part of the world. There are mainly Francophone countries. Through Jhpiego, with Jhpiego support, there is a program in Côte d'Ivoire and in Burkina Faso, my own countries. And recently, United and Expertise France, which is a French cooperation agency, 4 countries will be engaged in secondary prevention using HPV testing and thermal ablation treatment. Those countries are Benin, and Togo, Guinea, and Burundi. To go back a little bit to what is happening with PAO, we have been also advocating for Francophone countries, even all the West African countries, 15 countries, which are part of an organization called the West African Health Organization. we have been trying to advocate for a kind of fund for cervical cancer that will allow to purchase the HPV kit and thermal ablation devices through a mechanism of bulk purchasing. Because among those countries, you have countries like Nigeria, which has almost 200 million population. Imagine if Nigeria decided to buy HPV kit, probably they will need 100,000 kits, even more than that. If you add all the other countries need, we can have a big number. So we are trying to see if a bulk purchasing mechanism can be put in place. Because by doing so, definitely, I think the cost, Dr. Kamel mentioned that the cost of the kit, the cost of the thermal ablation devices will be reduced. With that, thank you very much. I will go back to Christy for the next panel.
Thank you very much, Blami, and thank you to all the panelists for sharing your experience, and Blami also for bringing that experience from Francophone Africa. It's really interesting also to hear different regional perspectives, to hear some of those success factors and enablers, and particularly thank you for highlighting in both of those, both of the panelists and Blami, the role, both of the kind of country ministries and governments, as well as the role of the global partners. And that really leads us very nicely onto the second panel, which will really bring some insights from a number of these global health institutions, some of which have been referenced already by some of our country representatives, and highlighting the role that they can play in supporting sustainability. It's now my pleasure to hand over to Samesh Kumar to moderate and introduce this second panel. Samesh is the Senior Director of Technical Leadership and Innovation and the Country Director in India for Jhpiego. Samesh.
Thank you, Kirsty. Very good morning, good afternoon, good evening, wherever you are in the world. And thank you for joining this this important convening virtual dialogue in your very busy days. Moving on from the first panel that talked about country experiences on how they have done their bit in scaling up and sustaining the initial demonstration projects for HPV test-based screening and thermal ablation. We will now move to a panel of global stakeholders, essentially, where we have participants and leaders from PAHO, PEPFAR, and UNITAID, and to give their perspectives on the initiatives that they are leading, their organizations are leading, and also what are the mechanisms, strategies for kind of making our efforts more coordinated and taking this agenda forward in a more accelerated manner. So I have with me three leaders from the organizations that I spoke of. Michelle Chevalier, Senior Advisor for Women's Health, Bureau of Global Health Security and Diplomacy, PEPFAR, U.S. Department of State. Shmilka D. Lucini, Program Manager, Diagnostics and Cervical Cancer, UNITAID, and Christopher Lim, Chief Strategic Fund at World Health Organization, Pan American Health Organization. So thank you, colleagues, for joining this important conversation. I'll probably start with Shmilka, who I know is stuck on a train in Switzerland. So Shmilka, thank you for taking the call from the train. So Shmilka, UNITAID has invested in the introduction of HPV test-based screening and thermal ablation for last 5 to 6 years through the Success Project and through the project led by Chai. And we have seen some great success coming from and learnings coming from those projects. So from what you have seen across programs that you are supporting, and even beyond, actually, what are some of the levers and drivers for pathway to sustainability. That is what have you seen from countries who are scaling up HPV test-based screening that is useful for other countries to be aware about, to know about? Over to you, Jhpiego.
Thanks so much, and really such a pleasure to be here, and especially to speak after the Philippines and Guatemala representatives who we were proud to accompany over the last 4 years in really an amazing path to actually adopting all these technologies. And I think both presenters covered a lot of points that actually I wanted to emphasize. I think also both countries really for us represent a very interesting and kind of good example of how that path from testing an innovation to actually then adopting it and then figuring out how to bring it to scale actually happens. But to your point, beyond just the Guatemala and the Philippines examples, there are really some of the considerations that we have seen across the 14 countries that we have supported with in partnership with CHAI, Expertise France, Jhpiego, and UICC. First, it was really that the integration is possible, and integration in the case of what we have seen really was about figuring out what the capacity already exists in country and build out of that from the perspective of capacity of programs. So some of the programs that already existed, because in many cases, cervical cancer programs are only in their nascent state and they need to rely on other programs that are much more developed, like HIV programs and family planning, maternal and child health programs. And then using that spare capacity to also benefit from, for example, existing infrastructure, but also better pricing and supply terms. And we have seen that, and I think Michelle might also speak to that. You know, when you consider HPV tests not only as a standalone test, but as a bulk test, the same virology test in the same perspective of HIV and hepatitis and HPV, and then discuss with companies that all of that should be looked at same volumes or joint volumes and bringing the price down in the kind of a volume-based price reductions. That's a very important and kind of very good driver for sustainability and for better pricing. The second one is that the diagnostic networks, especially after COVID, are there, and we just need to figure out, and it's not just, I know that I don't want to undermine the effort, but we need to think about how to then use those existing networks to deploy optimally the testing. And I don't think in any of the 14 countries we brought one single additional platform. Every country actually used their existing capacity to bring in HPV testing and then build off of that. We also need to think about the full cost of different options and how the right product selection might mean more women tested. You know, on the paper, X works price might be one, but when you add on all the other costs, it might really result in much higher costs. And we might actually test twice more women if we select the right product at the right price than what or some alternative product. I also wanted to emphasize, we have used a lot of HIV and TB learnings and established practices and systems to build a more efficient and cost-effective delivery. In so many countries, we use the sample transport system from HIV and TB programs to bring those samples much quicker. So many times I have seen that the countries use their results return that they use for viral load in order to add on the component of HPV testing and return to the healthcare facility much quicker. Also, I wanted to say just one more thing, maybe recognizing the value of task shifting and self-care. It was very interesting to also see to what extent I think Zambia is one of the kind of key examples that I love talking about, because I have seen what the nurses there can do, that where in order to actually expand the access, the task shifting went even to having nurses do the LEAP and excision And that works. I mean, with the proper mentoring and supervision and training, that really works for Zambia case. And I think these are kind of some of the things. We will not be able to deploy cervical cancer programs if we stay in healthcare facility and if we stay with only using gynecologists and higher level health care workers. So a lot of kind of levers are there. HIV and TB programs have definitely paved the way. COVID has helped from the perspective of capacities and in infrastructure. And I think we just need to, I mean, some of the different strategies were actually already evoked by Guatemala and Philippines. Thank you. I hope that is addressing most of what you hoped.
Thank you. Thank you, Jhpiego. So you touched upon across the value chain, right? You touched upon from the procurement, pooled procurement of and bucketing the different tests for efficiency purposes, right? And you talked about then you went to the service delivery pathway and leveraging the efficiencies that health systems provide in terms of task sharing opportunities and even self-collection. And you ended with leveraging the learnings from HIV and TB programs for more optimized sample transportation systems and the entire the service delivery efficiencies that and supply chain and lab system efficiencies that can be gained from that. So lot of learnings and essentially convergence and integration is the thing that you try to touch upon. I have a related question to Michelle, actually. Michelle, since Jhpiego talked about taking the learnings from or leveraging the learnings from HIV programs, given the role PEPFAR has played in strengthening national health system infrastructure to be able to rapidly respond to the HIV/AIDS and other emerging threats, right? What are some of the ways that countries can leverage PEPFAR-supported service delivery platforms to support the rapid scale-up of high-precision testing as countries aspire to move from essentially a VIA test based screening to more precise and more high performance test approach with, of course, treatment by thermal ablation and other mechanisms. Michelle.
Okay, great. Thanks so much, Samesh. And good morning to everyone and distinguished colleagues who are on the call today. So I definitely agree with a lot of what Smilka has said with regard to just some of the issues that we're facing within, ensuring that we can integrate and into national systems. I think some of the key enablers for PEPFAR's HIV sustained response that have helped to support our robust cervical cancer program include enhanced public health surveillance and monitoring, really focusing in on continuous quality improvement and management, thinking through donor resource alignment and innovative financing strategies, as well as sustained investments in local capacity building and health infrastructure. I think one of the things that I was thinking about when Smilka was talking is also, ways in which we've been able to really scale up differentiated service delivery in order to meet the patient where they are with the services that they need. In our case with HIV, but we really have been able to optimize that system. And so how can we leverage that for cervical cancer, I think would be also really important to think through, as well as the role for community mobilization, advocacy. And so ways in which we can really enhance the utilization of our community health workers in order to educate the community on cervical cancer, dispel misinformation in order to scale up, I think will also be really important. And that's something that we have done with the HIV response as well. I think that in addition, key considerations for scaling and sustaining cervical cancer screening impact are very similar to the concepts that PEPFAR is currently exploring with countries that have reached HIV epidemic control. And these considerations include the need to develop a shared approach between the governments, multilateral partners, and the community to sustain program gains. Also thinking through the creation of enabling policies and programmatic environments that are responsive to the data that is available, and enhancing the focus on strengthening and sustaining quality assurance programs to ensure positive health outcomes. You know, as we continue in these conversations on scaling and sustaining 70/90, I think PEPFAR is considering also how we can leverage these program enablers for the HIV response in a pragmatic way to address and eliminate implementation challenges that are really slowing progress in reaching WHO global cervical cancer elimination targets. I think the Go Further partnership, you know, we have been, you know, strategizing over the past year and a half in ways in which we can continue to accelerate progress in screening and treatment, precancerous lesion treatment. And so we're also looking at how we can leverage our capacity to convene thought leaders in the HIV and cancer space to collectively find solutions, and also think through considerations, you know, to learn from what we've done in the HIV response, with the intent of directly translating all of these learnings to what we're doing in the cancer space. So I think it's a really exciting time that we're in right now, and I think there's a lot that you know, we can learn, and so we're really looking forward to seeing how we can continue to work with partners as we transition into developing some more sustainable plans for cervical cancer moving forward. So I'll stop there, but those are some ideas.
No, thank you. Thank you, Michelle. You touched upon, again, similar threats that Jhpiego was talking about, and went deep into how we can leverage some of the HIV lessons from the HIV its programs and bring it to use of accelerated progress in secondary prevention for cervical cancer. And you touched upon the alignment of donor resources and public infrastructure, especially, and also on procurement systems, albeit very briefly. So I'll use that to segue to Chris, actually, who leads a lot of efforts. PAHO leads a lot of effort in this space. So, Chris, what are some of the financing and procurement mechanisms and/or tools that PAHO is supporting to ensure access to resources for countries to introduce and scale HPV test-based prevention and treatment for cervical cancer? And more importantly, or equally importantly, at least, how can best governments leverage your mechanisms? Some highlights, if you can share with us, and the challenges in this whole mechanism leveraging pathways that you have seen over last few years. Chris.
Thank you so much. And once again, good morning, good afternoon, good evening, wherever you are. So my name is Christopher Lim. I'm the chief of the PAHO Strategic Fund based out of Washington, D.C. So great question, right? Maybe let me just take a step a little bit back. So within PAHO, or Pan American Health Organization region, we are unique in the sense that we have got two very specialized funds, namely the revolving fund for vaccines and the strategic fund for public health supplies. So both funds work very much in an interprogrammatic way with our member states within Pan American Health, within the LAC region, right, the Latin American and Caribbean region. And collectively, we have got over 60 years of experience in helping our member states improve access to end-to-end medical countermeasures, which includes vaccines, therapeutics, diagnostics, and vector control. So, and the things that I would just also want to highlight that we are not just a procurement agency. We are more of what we call a technical mechanism, right, that culminates with procurement. And what do I mean by that? As we have heard earlier on, there are, the challenges with, many of the challenges with food procurement, or, access in general, access to diagnostics and medicines and health technologies, has to do with a lot of issues, right? It could be planning and forecasting. And we also heard a little bit around, very decentralized demand. Even in, I think was mentioned by Professor Dahl that, in West Africa itself, the demand is huge. But if there is no mechanisms that actually help them to, I would say, do market shaping, at least from a demand perspective. So what do I mean by market shaping from a demand perspective, right? It's, first of all, is alignment in terms of, let's say, treatment protocol or testing protocol. If every country is utilizing a different protocol and therefore it calls for a different medicines or a different diagnostic kit, you really are sub-optimizing the leverage of pooling of demand, right? So the whole thing is about, first of all, addressing or I would say harmonization of protocols, right? And that itself will give a leverage in terms of consolidating of needs. So that's one thing. But of course, we also have heard from the example of the Philippines, right? Every country is sovereign, right? They will have the rights to decide what they want to use, how they want to use, and so on and so forth. So really that whole argument or that whole incentive or notion of HTA, Health Technology Assessment, to essentially use evidence to dovetail or help countries converge, it's very important. So that's one part of market shaping or demand shaping, right? The standardization of protocols. Now, beyond that, for those of you who have been involved with, access, you also know that, okay, protocol is one thing. The other challenges that a lot of countries, it could be on protocol, but it may not necessarily be on your national formularies, your national EML, EDL. Therefore, a timely updates of those. So you can see that there's a lot of nitty-gritty intertwined issues, which unless it's being resolved in a systematic way, you will not actually end up having, the right tests, the right medicines to be arrived at in the arms and the mouth of your constituents or patients, right? So in that sense, from the street fund and revolving fund perspective, we work with countries to really look through what are the systemic issues related to access. And then ultimately, once all these are resolved, the pool procurement piece comes in. So you could see there's a lot of pre-action that needs to happen before the pooling can happen in a proper way, right? And also there was, I heard earlier on, there was mentioned, and it is a big issue, especially in bigger countries, right, where the needs could be there, but because the execution and even the procurement or the planning itself is so decentralized, especially if you think about federated countries like, let's say even maybe in India, Brazil, Mexico. Why has HIV, tuberculosis, and malaria, let's say, been so successful? It's because it's a national-led program, and where planning and executions are done centrally. Whereas in cases, and I would say this is the case for a lot of NCDs, right? Cervical cancer is really just one of those. It applies. I can say the same thing about oncology, typical oncology, cardiovascular disease, mental health, diabetes. They all have the same issue, right? Where it's decentralized. The planning, the budgeting, the execution itself is sometimes pushed down to provinces, states, municipalities, and sometimes even to the primary healthcare centers. And therefore, if there is no mechanism that helps them to act and think and execute in a more centralized manner, as much as the demand is there, you can never reach that economy of scale that I think Dr. Carmen has been talking about in terms of reducing price and so on and so forth. So again, one of the things that we help member states to do is we have also recently deployed what I'll call a member state portal. It's a digital tool that actually is available for all member states to do their planning at the very decentralized manner. Then it gets rolled up, progressively into a country, and then later on into the entire region of the Pan-American region itself. And also at the same time, we also provide forecasting tools. We have recently also rolled out this tool known as QuantMats, It really first started off with HIV, and we progressively rolled it out to malaria, to NCDs like pediatric oncology, hypertension, and of course we are also thinking about rolling out to cervical cancer as part of the cancer elimination initiative that we have. So all in all, it's a lot of programmatic work that leads into procurement, right? And that's really what our mechanism does within Pan American Health Organization region itself. And last thing just to mention, many of the so-called other pre-work, and this is really part of the challenges as well and hurdles, right, are policies. And I'm not going to elaborate too much about it, but there will be definitely policies that needs to be thought through and I would say modified. Like, for example, it could be related to procurement policies, right? Could be related to intellectual property management. It could be related to registration, right? So there are many policies related to this whole end-to-end access that again needs to be also analyzed and be harmonized to some extent, if possible. And again, this is also part of the work that PAHO, not really strategic fund, but through strategic fund, we will look at where the barriers are, and then we will get the associate, the relevant departments to help with the strengthening piece, just to make sure that this pre-work are actually all resolved before the access can really become sustainable and more available. Thank you.
Excellent, excellent points, Chris. Basically, you said there's no silver bullet, right? There's hard work to be done. There's a lot of convergence, harmonization that needs to happen for the efficiencies to kick in, the economies of scale to kick in. And that given the health systems, the way the health systems are structured in different countries, from a federated to a decentralized system to a more centralized system, and of course the smaller countries and larger countries. So there has to be some kind of a mechanism for more coherence in pooling of demand that can then catalyze some of the cost efficiencies. So maybe I'll continue with you with one more thread. So a thread of conversation. So we have heard that there are access prices, right? Global access prices that manufacturers have committed at a global level. But from our experiences, and I'm sure in most of our experiences, these prices are not really available to the governments when they want to procure it, especially when at a more decentralized level, or even at a smaller health system, right? So for multiple reasons, we know, although the distributor, the margins, etc. How can that be alleviated or do we need to go through the whole chain for all of this to work and price efficiencies to scale in? Are there interim solutions? Like if a small state in my country, in India, wants to start something, does it need to go through the entire chain? And why can't it get the $12 price or whatever price? Is that at all a possibility, or the whole process, or do we need to go through the whole pathway of harmonization before we reach that? Is there interim optimism there available somewhere?
Sure, thanks, Sumesh. I think that's a great question and a pretty complex one as well. So one of the things that I would say maybe that I didn't get a chance to elaborate on, right, is now what's the value proposition, I think, for a mechanism like us, for member states, and also at the same time for the producers, right? So that it makes a very compelling win-win situation for both parties, right? The industry and also the recipient, which is the country themselves. I think the first thing I would say is that again, fairly unique to PAHO region. We have, because of the mechanism, and we also have got specialists that work in the regulatory aspect of access to medicines and health technology. And this department of ours actually work very closely with the regulatory authorities within the region of the Americas. And through the initiatives of regulatory harmonization and slowly the convergence that I talked about, and then moving on to regulatory reliance. I think I did mention earlier on that in the region, other than recognizing the WHO pre-qualification standards and the SRA, the stringent regulatory authorities, we also rely on 8 of our national regulatory authorities in our region who has been identified as reference sites. So it's US FDA, Canada FDA, COFEPRIS from Mexico, ANVISA, Brazil, and so on and so forth. So there are 8 of them. And the compelling fact is that now a producer, as long as they are pre-qualified by us, as in PAHO Strategic Fund, then they have the rights to, or rather through us, countries would then be able to access to this, to their technologies, regardless of whether has the product or the technology been registered in the country or not. So in that sense, you could see that there is, so the so-called compelling reason for industries or for companies to work with, to want to have to work with us, is that through one point of contact, they would have access to a big market, right, of 55 countries in the region. And then the other compelling, the other factor for us is that we have this single price policy. So i.e., we will only negotiate and establish a long-term agreement for a single price to be accessible to all member states, regardless of their socio-economic status, regardless of the volume that they order. All right. So in that sense, it becomes accessible in an equitable way to both big countries, upper middle income countries, lower middle income countries, and low income countries, all at the same price in a very equitable manner. All right. So that's going to be a win-win for both the industries and also the constituents in that sense. So it's really around the whole harmonization and reliance and convergence itself. And then the other thing I would just say that is the whole technical cooperation, right? The piece that we need to make sure that the receiving the receiving countries have the appropriate conditions, right, and the environment to really receive these technologies, both from a planning perspective and that they have the right capacity infrastructure to distribute, and also at the same time make the right decisions, right? So earlier on it was mentioned about understanding the cost, right? We should not be just looking at the cost of the diagnostic test, or especially diagnostic tests, because if we go through the total cost of ownership analysis, a big part of the infrastructure is really around maintenance, right? So part of the study and understanding is, now what are the already existing infrastructure that you have? And I think Michelle mentioned earlier on about trying to leverage off infrastructures that has already been established, let's say for HIV and TB. Those are the type of consideration I think we also need to work with our member states to understand now, what is your condition? What's the situation right now for you? And how does that apply then as part of what sort of condition thereafter in order for you to scale up, that you can leverage on to scale up testing for HPV and so on and so forth. So again, total cost of ownership is an important consideration. Thank you.
Yeah. Thank you, Chris. Very, very informative. So since you talked about partnership with the private sector and creating that mechanism where through this partnership you'll have single price policy, regulatory harmonization, etc. So with that, I'll move to Michelle. And Michelle, can you talk about Go Further and the role your partnership with private sector plays in accelerating the access to these technologies in cervical cancer prevention?
Okay, great. Thank you so much for those for that question. And also I really appreciated the comments from our PAHO colleague as well. I think there's a lot that we need to think through with regard to the purchasing and pricing of resources. So as you know, the strategic pillar for PEPFAR in terms of our 5-year strategy really highlights the importance of partnerships and scaling efforts for maximal programmatic impact, as well as ending AIDS as a public health through 2030. I think through the collective efforts of Go Further, which is a public-private partnership that includes the George W. Bush Institute, UNAIDS, PEPFAR, Merck, and Roche, we really have been making tremendous strides in reducing the incidence, morbidity, and mortality of cervical cancer in countries with the high HIV burden, particularly in women living with HIV who carry the most increased risk of cervical cancer progression. So global partnerships such as Go Further really provide a unique opportunity for the private sector, government, and multilateral organizations to really come together and capitalize on their unique technical strengths and relationships between pharmaceutical and philanthropic organizations with the intent of really focusing on areas of mutuality, right? And so bringing together diverse points of view really allow us to improve systems of efficiency and interventions, and ultimately create a more inclusive environment for improvement and enhancement and change. I think overall, our mantra for Go Further and PEPFAR is really the idea that by working together, we can go further than on our own. And so Go Further partners work across the board with governments and policymakers, program implementers, service providers, communities, and the pharmaceutical industry to provide a comprehensive approach to cervical cancer control. Just to give you a little flavor of Go Further, each partner brings unique areas of expertise to strengthen and help with the collaboration. For example, the Bush Institute leverages their convening powers and educational efforts and leadership in order to ensure high-level commitments on cervical cancer elimination, and to really raise the profile for cervical cancer in the global arena. And then you'll see with UNAIDS, they share their data collected on policy and service integration indicators and other strategic information to assist with formulating strategic and policy recommendations for country governments and partners. And then you'll see Merck provides an already proven effective HPV vaccine and are engaged in a lot of studies in order to determine its best use in women living with HIV. And then with Roche, Roche helps helps with the reduction of existing disparities in the cervical cancer care pathway, particularly with our focused population of women living with HIV. They assist Ministry of Health to expand sustainable cervical cancer screening and treatment programs, and also help us to make sure that services are accessible for patients based on innovative solutions. And then when you look through PEPFAR, we are really the implementing arm, right, of the partnership, monitoring and leading co-leading oversight of the partnership. So, when you think about partnership, I think Go Further is really a brilliant example of how we can recognize the value of the private sector and how they're attempting to crowd in partners who prioritize the critical nature of women's health. I think investments in PPPs are critical to really enabling national governments to strategize on ways to provide scalable and sustainable services for women for cancer prevention through the cancer journey, through helping and enabling them to think through dedication of national resources, and also thinking through how we can create enabling policies and coordination at the country level on this area. And just to give you a sense of, what partnerships can really do through Go Further, we really have been able to rapidly scale over the last 6 years to help with achieving 7.4 million cervical cancer screenings in 5.5 million women. So I say that as an example, just to show that there's so much that can be done in order to rapidly accelerate. And so just how I think as we think about sustainability, we really need to continue to think through, you know, which partners are really optimally placed within each of the within each of the countries in order to help feed into the system in a way that makes the most sense in order to continue to scale. So that's just some ideas around partnership and why we value partnerships so much, like go further in this space.
Thank you, Michelle. We all recognize the role of partnerships in this because it's such a whole of society and whole of civil society coming and the rest the organizations, private sector coming together to solve the various dimensions of this this problem that we are trying to solve together. So maybe Jhpiego, I'll turn to you now. Through the experiences that you have had for last 5-6 years on implementation of these programs that UNITAID has supported across so many countries, so many geographies, and so many contexts. You are privy to some of the challenges, right? On countries who want to scale up, who want to invest, but are facing some limitations there. So what are some of the common threats that you are seeing, and any thoughts on actions, even if they're not there today, you know, on your prospective actions or strategies that can help alleviate some of those challenges?
Thanks, Amesh. I mean, some of them have been covered so far. I mean, Christopher was talking about accessing the global access pricing agreements, and we've done so much work to understand what actually prevents Guatemala accessing the price that we are quoted for Rwanda, for example, and we are seeing a lot of issues there, and you know, to the extent that it's a mix of even just having transparent pricing and then also publishing. So I think first and foremost, we all have a huge responsibility to publish everything that we are learning, everything that we are privy of as an information we have to put in the public domain. And you know, that I don't think that we are doing that necessarily well enough or broad enough, and that's where the kind of the partnership and these kind of platforms are probably the most useful to kind of gain that momentum and sharing. So that's the first thing. The second thing, cervical cancer is the area where the role of domestic financing is much more pronounced than in other diseases that we typically have been working with, right? HIV, TB, malaria, and we really need to support countries in making a broader investment case, especially on first and foremost costing all of this, and costing in a way to understand different options, and also capture the effect of building a cervical cancer program and strengthening the entire cancer response, NCD response, PHC agenda, etc. So cervical cancer is not a one small investment. It's an investment that has so many additional kind of effects. The other one is that we need to start unpacking the pathways of adoption based on different readiness and epidemiology. We cannot be seeing a country that used to work with VIA the same as the country that works with LVC, and the kind of the financing perspective might be different. So we need to recognize also that many countries will not be able to make a quantum leap, and in such context appreciate the different speed and different steps and the value of each of those steps. So if the countries, I know that PEPFAR supported so many screens, and Michelle, I'm always impressed with those millions of women, and those are an amazing kind of basis for building any additional innovation, and we have benefited, UNITAID programs have benefited so much from what PEPFAR has established with national programs to just add the innovation, unlike some other countries where we didn't have anything to add on. So we need to appreciate small steps. Those are important steps. Also, we need to encourage more south to south learning. We have to elevate national excellence, and there's so much of that excellence in every country. on every perspective and every aspect. And as I already said, lessons sharing and supporting environment, but really there is no better excellence than having a team from Zambia go to Sierra Leone and support nurses there on how they can do thermal ablation and LEAP, etc. And this is something that I know the WHO is working on figuring out. And I think we as partners also have a moral responsibility to really leave behind our investments also the national and local excellence. And then last one, I wanted to say that we should, the low-hanging fruit is definitely the HIV response and the solution and learnings from them. And while these are being used differently across countries, I think also we can be smart to see how these can benefit women beyond those women living with HIV. Those are going to be systems and processes and services in place that can benefit all women so that no woman is left behind. So I think I'll end up there. And yeah, happy to elaborate more. Thanks.
Yeah, I think the mindset will be very important here, you know, because the challenges are there in different contexts, and we are talking about some common themes here, right? Leveraging of learnings, integration, optimization. Those are those partnerships, convergences. So to unlock some of the efficiencies, as well as you know, other levers for pathway to scale. So to sum up this, and I'll ask all my three panelists for a very short remark on the highest priority couple of things that you would like to see in next 1 year in the next steps as for progress towards the 1790 goals in the short term, and that is what is it that you would like to see in the shorter term, doesn't matter 1 year or whatever, in the shorter term to accelerate progress in this space. So maybe I'll start with you, Chris, and then Shmilka, and then Michelle.
Thanks so much. Yeah, I would say, at least from our perspective, I would say that, you know, political will is at its utmost, in a sense that and I've articulated earlier on that many of the factors and barriers, in a sense, are pretty much man-made. It could be related to funding, sustainability of funding. It could be related to the different policies associated with, be it procurement, treatment, be it regulatory. So a lot of all this are, in a sense, man-made, and obviously could be circumvented and overcome if there's a political will. So in that sense, I would say it's really the most utmost critical success factor, if you ask me. Thank you.
Shmilka.
Sorry, I'm balancing two devices. Yes, three things, very short. Partnerships, we already spoke about it, but really building on the collective knowledge, commitment and resources. Second one, listening and hearing from women, communities and countries. And then the third one would be, this is really something that a lot on my mind, going from opportunistic programs to routine programs. I cannot really emphasize more this. I'm still to see a very strong program that is a routine program, but if we don't start charting the way to that and then understanding what each country needs, together with the countries, of course, and then supporting that, we will not get to 1790. And this is the time. We know how to do it. We just need to basically sit and chart this out together. Thank you.
Thank you, Shmilka. Michelle.
Thank you so much. All the great ideas have been mentioned, but I think one of the things that I would love to add to the conversation is really, you know, from an implementation standpoint, we have a great mandate ahead of us with regard to really reaching these goals. And I think that as we are really trying to think about scalable scaling high precision testing, we really need to think through what that looks like from a national perspective, given resource limitations. It's easier to think about it, you know, for the countries that have more resources, but how can we work as a community to really drive down the prices and make it more accessible? I think it's a big challenge, but it really depends upon partnership and working together. I was really inspired by the comments from Christopher about, you know, the ways in which you're utilizing that regional approach to ensuring purchasing power. And I think that is a key. If we're going to try and really do this pivot to high precision testing, we really need to think through how we can work together regionally in low resource settings. And I think also we didn't touch too much upon this, but, you know, tertiary care is really important, and it's very hard for many countries to reach the ability to be able to provide advanced therapies for advanced cancer treatment. So there's a lot that needs to be done in that space, and it's going to rely upon you know, getting financing for that, as well as the right partners in place in order to help support palliation, as well as you know, all of the wraparound services for advanced cancer therapy. And so what can we do as a community to really help countries be able to reach that goal, I think is something that we need to dig into a little bit deeper moving forward. So I'll leave it there.
Yeah, it's a very important point, not stopping where just at the screening and ablative treatment, but taking the care, making sure that the entire pathway is thought about and we don't leave those women to fend for themselves. So essentially 3 common points: political will, partnerships, and listening to women, listening to communities and women, more importantly. So thank you so very much to our panelists, Chris, Shmilka, and Michelle, for your time today and for your very insightful remarks. Really appreciated that. And I know we will also make sure that these remarks, these learnings that we will document, and it goes to more people than who have already joined, and a great number of people have joined today. So very, very effective, and thank you so much again. So I'll hand it over back to you, Kirsty.
Thank you so much. And yes, absolutely. Very keen to share these learnings and these thoughts with more people. I think, Chris, you mentioned in one of the comments about the need to raise awareness more about the work that's being done to support access to these services. And Michelle, fantastic point to finish on about supporting advanced treatment for advanced cancers as well. It's so important and a key part also of this whole approach. So thank you so much for elaborating on all of those points around access and really bringing them to life in a very accessible way. We are out of time. There's many more points we could reflect on, and I'm sure much more discussion. Thank you to all of those who have participated as panelists for those comments. Apologies for the questions we didn't manage to get to. I really hope it's been a helpful discussion for you in your different contexts and roles, and that you are able to continue this conversation in different ways in the days to come. We'll make the recording of this dialogue available on the UICC website as soon as possible. And just to remind you, the one from earlier this year around really focusing on lessons around implementation, so those challenges in implementation, is also available. But thank you so much for your participation, and I'm sure we'll be in touch with many of you soon. Thank you very much for joining.